Welcome back to Heartbeat with JoJo Williams. Listen, I'm telling y'all, it's been a crazy show because I done been around just asking the simple question: what song that got you through when you're going through? And this week I heard some amazing song, and I'm down here with Doc. What's up? You know, I love this segment. I love this segment right here because at the end I know I'm gonna get a crazy song from you too that I don't see coming. You know, but Doc, me and my wife was in a car wreck, you know, and I think a lot of people need to know why they need to go to a chiropractor after an accident, even if they don't feel nothing right then.
Right. Well, I'm glad you mentioned that. You know, that's how you and me and your wife met originally. And really, when something happens like a car accident, you know, person should get checked. My suggestion would be, you know, go to an emergency room or call your doctor and get checked. And if you don't have anybody, you know, you can call us and come to us. But don't wait. You should get checked anyway. Even if you don't have too much symptoms to begin with, the things can get worse over time. You know, the typical type of accident that I see my patients go through is, you know, you stopped at a traffic light and somebody behind you just doesn't pay attention and slams in the back of your vehicle. They might be on the cell phone. That's pretty common these days. But there's other types of accidents as well. So, you know, the inflammatory changes that start at the time of the injury are not at their max. They are going to grow. Over time, they're going to get worse. So, you know, the way the person feels right away is really not reflective of what type of injury they really had. They can get a lot worse 2 or 3 weeks later than they are right at the scene. Also, your body will release endorphins, which are the natural painkillers in the body. So, you know, there's a lot of these things that have started as a process, but if you don't find out just how bad it is and don't get treated, they're going to leave, you know, a mark over time. They're going to become chronic issues. So, you know, to alleviate that, that should be treated right after the accident. So the sequence of events should be a thorough examination, which we do as well, orthopedic examination. You look at different areas. Of course, you do vital signs, but you do neurological exam, you do muscle exam, you do range of motion. You want to see if you move in a certain way, if that causes any problems. And, you know, it's not just about pain, it's about, you know, in degrees, how much the person can flex a certain way or extend or left or right. And that would also tell us if there's any kind of numbness or tingliness going down the arms or the legs. That's another telltale sign. So there's a lot of things that can happen. Muscle weakness, we use this digital dynamometer. When a person will squeeze, it would record how strong the muscles are. Well, these muscles are supposed to be certain strength for your age category. However, if they're weaker than what's supposed to be, something is probably wrong with the neck, because some of the nerves from the neck, they travel all the way down to your arm. So they go to these muscles. So that means if you're weaker in your hand, let's say you are dropping objects like your car keys or maybe a glass or something at home, it's just not as strong as it used to be. Well, that indicates something is wrong with the neck. You probably had, you know, a whiplash or something like that. So that should be looked at. Then we also take x-rays. You got to look at the picture. You got to look at the spine. Everything comes from the spine. The vertebrae, which are the bones in the spine, they can misalign. They can get out of their normal positioning. They can get stuck like that. That's called joint fixation. The nerves come out between it. So they're going to be irritating these spinal nerves, which go to different parts of the body. So we need to evaluate that and see if that's something that needs correction. Muscle spasms, the muscle tissue can injure. You know, there's inflammation, edema. That can also needs to be. So the soft tissue can be damaged as well. So just because somebody doesn't have broken bones, that really is just on the surface. Almost all of my patients never have broken bones. That I would not see them if they did. They would go to an orthopedic doctor. But they have all kinds of other injuries that can be corrected.
Well, I tell you what, Doc, you know, you got to tell the folk where they can find you.
Oh yeah. Well, I have 2 offices. One is in Grovetown Accident Rehab, and it's right on Wrightsboro Road and the Forest Plaza. I mean, it's right in the middle of Grovetown. And the other one is Aiken Chiropractic, and again, it's downtown Aiken on Lawrence Street. It's literally a block or 2 away from the main post office, right downtown on Lawrence Street, on Main Street.